We're in the middle of the holiday season and we're in the middle of a pandemic. How can we celebrate safely? Today, I am speaking with Clackamas County's Public Health Director, Philip Mason Joyner. Welcome, Philip.
Thanks, Kimberly.
I want to visit my relatives and my friends, but I don't want to catch COVID-19 and I don't want to give it to anyone else. What's your advice on what I should do?
Well, that's a really good goal. Right now, we are seeing still an increase in a surge in cases with winter weather and holiday gatherings. And it's really important that folks continue to do what they can to protect themselves and others from COVID-19. I completely understand as a public health official that folks want to get together and celebrate the holidays. My general advice is to really focus on what's most important to you, that you need to dedicate yourself to limiting the risk to yourself and to others doing that one thing. So this means minimize your exposures a week before and after these activities. Really prioritize. This year is going to be different. You can't do everything you usually want to do. And make sure you have open communications with the friends and family that you will get together with. Talk about who you're interacting with, what your risks are, and be flexible with your plans as they might need a change if someone becomes sick.
Well, that's good advice. And sometimes it's awkward to wear a mask around people we feel comfortable with. So how do you answer when people say, I'm not really at risk, and why should I wear a mask and social distance?
Well, first I want to make sure folks know that everyone potentially could be at risk from COVID-19. It's a really novel virus, and we're learning a lot about it. Over the past year, we continue to learn. In general, yes, those at highest risk are older adults, people of color, folks with underlying health conditions. So if you are younger, healthier, I want folks to know that your individual behaviors really have an impact on other people in your life that are at higher risk. Severe illness, hospitalization, and even potentially death. That's why following the public health guidelines that we've been saying for months is still very important. Limit your social gatherings, keep your physical distance, wash your hands frequently, and wear those face coverings. Yes, it's uncomfortable to have to wear a face covering with folks you know, but it will do a whole lot of good in helping to reduce risk.
Who's going to get vaccinated first and when?
So the first individuals who will receive the COVID-19 vaccines are our frontline healthcare workers, along with staff and residents at long-term care facilities. And there isn't enough yet for all of them to have access. This month, in December of 2020, Oregon anticipates receiving around 150,000 doses. And since the first vaccine is 2 doses, it'll be able to provide protection for around 75,000 people.
So it'll be a while before there's enough vaccine to take care of these groups, and even longer before the vaccine comes to the rest of us.
That's right. It's going to be a while before there's enough vaccine that can be distributed, and there are different phases for implementation of this. The next groups will be focused on our first responders, other essential workers, and those individuals at higher risk that I mentioned earlier, older adults, people of color, and folks with underlying health conditions. It's going to be a while, potentially months, before vaccines are available to the general public.
Well, thanks, Philip. I want to make sure you know about the resources Clackamas County and the state have for you in these troubling times. Visit Clackamas County's website at clackamas.us/coronavirus. The state also has a comprehensive website, and their website is coronavirus.oregon.gov. Thank you for joining us. We will see you in 2021. Please stay safe.